City! Nandito na naman tayo sa another episode natin. And for this episode, pag-uusapan natin yung tinatawag na burnout among health professionals. So, ano nga ba to? Paano ba natin malalaman kung nagkakaroon na tayo ng tinatawag na burnout? And paano ba natin to ma-prevent? So, ayun guys, wag na natin patagalin pa and i-discuss na natin ito. First things first, i-discuss muna natin kung ano ba ang definition ng burnout. So, burnout is a state of emotional, physical, and mental exhaustion caused by excessive and prolonged stress. And ngayon naman is pag-usapan naman natin kung ano yung signs and symptoms ng burnout. So, for the first one is start muna tayo sa physical signs and symptoms. So, for physical, una, feeling tired and drained most of the time. Pangalawa, lowered immunity or frequent illnesses. Pangatlo, frequent headaches or muscle pain. And lastly, change in appetite or sleep habit. For our emotional signs and symptoms, first, sense of failure and self-doubt. Next, feeling helpless, trapped, and defeated. Third, detachment or feeling alone in the world. Fourth, loss of motivation. 5, increasingly cynical and negative outlook. And last but not the least, decreased satisfaction and sense of accomplishment. Now, for our behavioral signs and symptoms, first, withdrawing from responsibilities. Second, isolating yourself from others. Third, procrastinating or taking longer to get things done. Fourth, using food, drugs, or alcohol to cope. Fifth, taking out your frustration on others. And six, skipping work or coming in late and leaving early. Tumako naman tayo kung ano ba yung mga cause ng burnout. And kadalasan, especially among us health professionals, ang kadalasan pinanggagalingan syempre ng burnout is work. So ano-ano nga ba ang work-related causes of burnout? So first, feeling like you have little or no control over your work. Pangalawa, lack of recognition or reward for good work. Pangatlo, unclear or overly demanding job expectations. Fourth, doing works that's monotonous or unchallenging. And lastly, working in a chaotic or high-pressure environment. So ngayon, prevention naman tayo or paano ba natin maiiwasan ang burnout? So para dito, magbibigay ako ng 3 R. So ano-ano nga ba to? So for our first R, recognize or watch for the warning signs of burnout. So nabanggit ko kanina yung signs and symptoms, and pag na-feel na natin or nakikita natin na signs and symptoms na to na magkakaroon tayo ng burnout, gumawa na tayo ng agarang action para dito, para hindi na tayo umabot sa point na tuloy-tuloy na yung burnout and makaka-apekto pa tayo sa iba or matutuon natin yung burnout natin sa ibang tao. So, from there, gawa na agad tayo ng action. R naman is reverse or undo the damage by seeking support and managing stress. So, for this second R, tandaan natin na sa bawat laban natin, hindi tayo nag-iisa. Meron at meron kahit konti or isa lang yung kaibigan natin, pwede tayong pumunta sa kanila to seek for advice. Dahil in the end of the day, hindi lahat ng laban sa lalo na sa healthcare setting which is sobrang challenging, hindi lahat is kaya nating harapin mag-isa. So, ayun, mag-seek tayo ng support sa ibang tao, pwedeng friends, and pwedeng family members. And for the last but not the least na R, is yung resilience. Build your resilience to stress by taking care of your physical and emotional health. So, alam naman natin lahat na sobrang hirap ng trabaho natin as healthcare professional. So, ang resilience kasi is ito yung kakayahan natin na mag-bounce back galing sa pagkakadapa is kaya uli nating tumayo. Tandaan natin guys na as healthcare professionals, tayo lang yung inaasahan ng mga patients natin. Kung susuko na tayo sa kanila, paano pa sila gagaling? Tayo nga yung health professional, so kailangan maging matibay tayo and ayun nga, resilience, bounce back. So bago matapos ang vlog na to, mayroon tayong isang tanong na kailangan munang sagutin. Labas na to sa Burnout. So yung question na to is, you are a therapist in a skilled nursing home and the patient you are treating asks you to spend a moment with her in a prayer before the treatment. What would you do? And next question is, how would you respond to the parents making the same request before you treat their child with severe burns? So, para dito, ang gagawin ko as a physical therapist or a healthcare professional, tandaan nyo guys na as healthcare professionals or physical therapy, ang approach natin for every treatment and for every patient is holistic approach. So for holistic approach, hindi lang tayo nagfo-focus sa physical, kundi kasama dito yung mental, social, environmental, and yung spiritual. So ang tanong dito is, ano daw yung gagawin ko kung sinabi ng patient na mag-pray muna kami before the treatment. So syempre, papayag ako, lalo na kung yung prayer na to is paniniwalaan niya na mas papagalingin siya sa condition niya. So there's no harm in doing, especially in prayer. Kung ito yung pinapaniwalaan ng patient natin and makakabuti to sa kanya, why not, di ba? Dito siya naniniwala, so kailangan natin respetuhin ito. And that is it for our vlog, mga sir, mga kapiti. Alam kong hindi ganun karami yung pinag-usapan natin today, but I hope marami pa rin kayong natutunan, lalo na dun sa additional question natin. Sana natuto kayo about that. I hope. And ayun guys, kita-kits uli sa next episode and peace out.